Hola, muy bienvenidos al programa de alfabetización digital en salud. Mi nombre es Analia Baum, soy
Hello and
consultora
welcome to the Digital
internacional
Literacy in
en
Healthcare. I'm Analia Blau, an international
sistemas de
consultant for
información en
the
salud
team
de la
of
CRVS.
Healthcare
Y
Information
bueno,
Services for
hoy
PAHO.
tenemos el tercer
And
webinario
today
de
we
este programa
have our
sobre
third
registro
webinar in
civil
this
y
program about
estadísticas
civil
vitales. El
registration and
primer
vital
webinario
statistics.
ya,
First
digamos,
webinar
hablamos sobre
was one where we
los
talked
registros
about
estadísticos en
the
la
statistical
era de la interdependencia
records in the
digital.
era
Después
of
tuvimos
digital
nuestra clase
interdependence, and then we had
magistral
our
sobre codificación
masterclass on
automatizada de causa de muerte.
automated
Y
coding
hoy va a
on the
estar
cause of
nuestro
death.
este
And
expert,
today
o
we're
vamos a
going
ir
to
al
have
estudio con
our
Catri
Meet the
Conti, que es
Expert with
asesora
Katri Conti, who is
regional de sistemas de
the
información en
regional
salud
consultant
digital, que va
on
a analizar
digital
los elementos de
healthcare
la
information
transformación
systems, who are going to
digital
check
en
the
los
elements of
registros
digital
civiles y en las estadísticas
transformation and
vitales.
civil
Y ella va a
registration
dar
and
su oratoria
vital
en
statistics.
inglés, pero ustedes
She's going to
tienen a
address
disposición
us in
para
English,
elegir
but
el idioma
for your
de su
availability, you can
preferencia
pick the
y
language
también
of your
ya está
preference.
habilitado para
And
usar el icono sobre
you'll see
preguntas y
also the
respuestas.
icon
Ahí
of
pueden
Q&A at the
ir
bottom where
ustedes
you'll be
poniendo
able to
todas las preguntas que
formulate
surjan y al
any
finalizar
questions that may
la
come up.
presentación,
And
Catri
then
va
at
a
the
ir
end of the
respondiendo.
presentation,
Les
Kat will
recuerdo
be
que el
able to
programa de
answer.
alfabetización digital en
Allow me
salud
to
es
remind you
parte del
that the
itinerario
program of
informativo en salud
digital
digital que está
literacy in
disponible en el
healthcare is
campus
part of the
virtual
digital training
de salud
available in the
pública de la
virtual
UPS.
campus of public
Si
health
ustedes buscan itinerario
from PAHO.
formativos en
If
salud
you
digital,
search
ya van a ver
training
publicado
programs in
nuestra
digital health,
primer
you'll
cápsula de
find
conocimiento
our
sobre
first
inteligencia
capsule of
artificial.
knowledge on artificial
Esta semana va a
intelligence.
estar disponible a
And
final
this
de la
week will
semana
be
la
available at the
segunda
end of
cápsula de
the week,
inteligencia artificial
a
sobre el uso de
second
IA y
capsule
prompts,
of
y la semana
prompt
entrante, luego
engineering
de
and
ya
artificial
haber
intelligence. And then
culminado con el
next week,
ciclo de los tres
having
webinarios
finished
sobre registro
the
civil y
cycle of the
estadísticas
three
vitales,
webinars
van
on
a tener
civil
esa cápsula disponible
registration
con
and
todo el
vital statistics,
material
you'll have that capsule available
audiovisual,
with
el
all the
material
audio
de lectura y
visual
una evaluación
materials,
para
reading
poder certificar.
materials,
Recuerden que
and an
cada cápsula de
evaluation to be able
conocimiento que
to
estuvimos
become
dando
certified. So
respecto a la
let me remind
inteligencia
you that every
artificial,
capsule of knowledge in
registro civil
the
y
artificial
estadísticas
intelligence
vitales,
hubs, civil
telesalud y
registration, and
ciencias
vital
de datos,
statistics, telehealth,
cada uno
and
de
data
esos
science,
ciclos
each of
se
them
pueden
are cycles that can
cursar,
be
evaluar y obtener un certificado
studied,
que
evaluated
constate que
to
ustedes
then
ya
obtain a
adquirieron esas
certificate that
competencias
validate
emitido
that you
por el
acquire
campus
such
virtual de
skills,
salud pública de la
issued
UPS.
by the
Así que
virtual
estén
campus
atentos
of public health from PAHO.
a
So
las
keep
listas
an
en que
eye
ustedes
open
están
to the
todavía de
listings
práctica o
where
están
you are
inscritos
in your
porque
communities of
les van a
practice
llegar
where you
todas
are
las novedades
registered,
por mail.
because then you will
Bueno,
be
Catri,
able
creo que
to
dije
find
todo
all this
los
there.
anuncios que tenía que decir
Okay,
sobre
so
el
I've
programa
said
de
all my
alfabetización
announcements on
y
the
podemos dar
digital
comienzo a esta
literacy
sesión de hoy.
program, and we can start with
Gracias.
your speech, Katri,
Muchas
without further ado.
gracias,
Thank you.
Analia.
Thank you, Analia.
So I will give the presentation today in English. Um, and I have named the title towards end-to-end digital CRVS systems. So objectives today, I have defined three objectives. Understand the founders of the CRVS systems, what they are, why they matter, and how they integrate with the health sector. I'm not spending a lot of time on this because this has been covered, before, but it's a recap. We also discuss about the key challenges and opportunities in moving from fragmented systems to end-to-end digital CRV data flows. And in the end, they apply practical principles and pathways for planning, designing, and implementing these systems. So the first section, I focus the CRV basics and why they matters. This is a picture from UNICEF Namibia. And they put it, the correctly that the birth registration is more than just a right, is a passport to protection. So what is the CRVS? I have included two definitions from the United Nations Statistic Division, which defines civil registration as universal recording of the occurrence of the characteristic of vital events in accordance with the legal requirements of a country. And the vital statistic, as per their definition, is summary measures of the occurrence of the vital events and their characteristic from the civil registration records and other administrative sources. And why the civil registration and vital statistics really matters. It's one of the foundation of the legal identity. You need to have the birth certificate to legally exist. It's also ensures right and inclusions. It's easier to get access to services such as social protection, or in many countries, it's required to have the birth certificate to start a school. And also, it generates essential health and population data. We need this data, for instance, to understand the number and rates of birth deaths and fetal deaths, measures of fertility, mortality, life expectancy, and cause of death distributions. And of course, civil registration systems and vital statistics, they include many other things like such as marriages and adoptions. But our presentation on this morning focus on births and deaths. Civil registration data is also essential to measure many sustainable development targets. The slides includes 11 different targets selected. Many covers health, but also there are the other targets on sustainable cities and communities, peace, justice, and strong institutions, and global partnerships. And without the data, you can't measure any of these goals. In theory, the birth and death registration should be very simple. There are the few processes you need to notify that someone has born, and then you have to register that birth. And the same applies for the death. Someone dies. This needs to be notified from the health sector to civil registrar that allows the legal registration of the death. However, we will see, the later slides that, all that in theory, this should be very simple, but the reality, there's a lot of people in the world that, don't have their the births notified and registered, and there's also many unregistered deaths in the world. But this second section, I focus on the main core of this presentation. And the class, it's a digital architecture and integration and interoperability, and what this means and how to achieve it. So I start with the simple definitions. What we mean by the applications, it's just a software application that does different things. In our case, it could be, for instance, application that the capture and the notification of the deaths, or they might be application that allows the issuance of digital certificates of the deaths and births. Or it might be the coding tool, such as the Doris that codes death certificates with the ICD-11. Interoperability, we means that the way of many applications communicate within the enterprise, and the enterprise means a lot of applications working together to do a big thing. We want to distinguish integration for the interoperability. Integrations when different systems are connected so they can exchange data or trigger actions. This could mean two applications are integrated, and interoperability is multiple applications that communicate. And architecture design is how the software fits together to create an enterprise. The next slide, I would like to just to present the key civil registration of vital statistics processes and definitions. This slide is adapted from the Swiss Tropical Institute, Dr. Kopos, who has defined the 10 key core processes from the notification, registration to statistics. These include around 5 to 7 institutions, minimum. They are health facilities, medical certifiers, civil registry, national ID population registers, IT services, and National Statistic Office. And we have two outputs, individual legal record and aggregated vital statistics. And sorry. So we can see that it's a divided civil registration subsystems that includes the notification on births and deaths, the first alert that someone is born or has died, medical certification of the death, when doctor certifies the cause of death or fills out also the birth certificate, and this is needed for ICD coding. In some countries, also funeral homes might notify the death, but this is not the medical certification at that moment. And then the registration and certification, registrar office at the usually Ministry of Justice record event and issue the legal certificate. And then we move to vital statistics subsystems, which include compilation of the vital statistics and dissemination of the vital statistics. In the CRV ecosystem, the highlight is that health really plays a key role within the whole ecosystem, because the birth and death data comes from mostly from the health services. We are talking about the live births, deaths, and fetal deaths. And we can say that 8 of the 14 CRV data flows comes from the health. However, in the modern CRVS systems, we have much more complex architecture design, but also much greater benefits. And this conceptual architecture is very typical CRVS system in the modern countries that have digitalized the data flows. And why it becomes very complex, because they're more institution connected. There's multiple entry points. They have funeral homes, remote sites, health facilities, villages, community deaths and births. Interoperability needs the shared data standards, and the CRO becomes a part of national digital architecture. But it has much more benefits. It enables one-time registration, allowing the multiple services, stronger identity management, authentication, and the data share with the civil registrar, ID management, health, and e-government systems. And specific benefits for health is the real-time births and deaths, accurate population denominators, and better surveillance mortality data, reliable patient identification. You can keep your master patient index or population registries more intact, and also the benefits in bidirectional data exchange. This slide I wanted to just demonstrate the real live examples for modern end-to-end mortality surveillance architecture. Many considers at the global level that this is a gold standard where we would like to go in most of the countries. It's a demonstration of the Center of Disease Control National Vital Statistics System and mortality flow, which include 20 system connections, 10 standard and tools. It's HL7 enhanced and enabled system and FHIR. It has open APIs, electronic medical certificate of death, and currently is coded with the ICD-10 because the United States have not taken the official measures to move with the ICD-11 yet. And data architecture includes 8 to 12 databases, and it has roughly over 50,000 end users, physicians, funeral directors, registrar, and CDC analysts. But very beauty of this is that everything is automated. There's very few manual coders anymore needed in the United States. They have millions of the death certificates coded with the automated artificial intelligence enhanced coding tool, and they require only very few coders to manually code some specific cases. And now I would like to talk about the key challenges and their impact on the CRVS systems. So as I mentioned, in theory, this is very simple thing, linking health and CRVS systems, but in reality, it's not that simple. We have only one event, one record, one data flow. And every birth and death should trigger a single digital record shared between health system, civil registry, and statistical office at minimum. However, the data do not flow very automated and fluent way most of times because there's a lot of vertical siloed digitalization paper systems and no shared architecture usually. And this fragmentation occurs when the focus in an application as opposed to enterprise planning approach. And while several countries have made significant digital transformation process, many have do not have enterprise level architecture linking the different systems. So each of these bricks defines a digital silos, and each of these are the applications. For instance, hospital, registry office, and statistic office and funeral agencies, they might have each of the digital application, but they are not shared. So, which means that they need to upload and download, the data and share it with the Excel or in a paper means. And these are the common challenges are defined from the business process maps and analysis in the countries. There are many actors, no shared systems, 10 to 15 institutions involved, but no unified digital workflows. Paper-heavy processes, births and deaths notifications still rely on manual forms and signatures. There are very fragmented data flows. Health registry and statistic databases operate in silos without common standards, outdated legal frameworks. There's no legal basis for the e-certification, e-signatures, or real-time data exchange. Limited capacity and feedback. Staff lacks standard procedures, and registries rarely get feedback from the health statistics or statistic offices. And there's a lot of time non-standard coding. Many hospitals still use ICD-10 and manual coding of the mortality data. And this is how it looks on the fragmentation of the mortality data flows across health and CRV systems. Different demonstrations, where they are on each of the bricks are the one vertical silos, but there's also horizontal silos, meaning that the hospitals, funeral homes, and media legal, they don't talk to each other, but also how the data is transferred to for the statistic and civil registry and Ministry of Health is disconnected. Also to regional level, such as in Caribbean, CARFA collects sub-regional level of the mortality statistics, but this is not automated, from the countries yet. And also PAHO and the World Health Organization collects the mortality data, but the most of times we don't get it in automated way, but the country still sends us the Excels, for instance. I wanted to share that, the one of the gaps derives from the legal planning and procurement paradox and legacy systems. This is evident at the global level. Many digital government programs prioritize finance and administrative sectors, and health agencies are included mainly as the data sources with limited influence over architecture and procurement decisions. So health might not be included in the digital architecture. And there's also outdated and incomplete legal frameworks, particularly around e-signatures, digital identity, and data protection, continue to impede full digitalization with civil registration and health information systems. So this is really the reality. Also, when many applications are procured, they might be lock-in systems, and it's challenge in the later to integrate the other agencies as part of the civil registration software. And what is the cost of this incomplete and inefficient CRVS systems in Americas? We have still 1.3 million vital events unregistered yearly in Latin America. 90% of registered deaths medically certified, but only 77% have usable underlying cause information. There's big gaps between and within the countries, rural-urban gap. Also, there are more advanced digital mature countries and the countries that have mainly the systems and paper-based. And this creates blind spots from planning and crisis. And particularly in the region of the Americas, we have vulnerable groups which are not included, such as migrants, indigenous populations, and poorest households, disabled populations, shows 15-30% lower registration rates. And only 12 out of 35 PAHO member states publish high quality mortality data within 2 years. And these statistics is from the 2022. And the last section, I want to cover how to build digital interoperable CRVS systems. So first key principle is strong project governance. You need to establish country governance that includes multiple different agencies, civil registration, health, including digital health, statistic, justice, interior, digital government, and identity systems in order to have one shared vision. And this would facilitate the government to have national strategies and implementation plans. They build this enterprise architecture at the national level, enable the interoperability and use of global good applications to implement evidence-based digital health interventions to improve health outcomes. Second key principle is that technology and ICT should be an enabler of the CRVS, not the end goal itself. So what we want that CRV support the business functions and not replicate or digitalize old paper workflows. We need the business process re-engineering to design new digital workflows that are efficient, secure, and user-friendly. And we would like that these systems should reinforce the full flow from the health notification of the birth and deaths, their certification, registration, and creation of the vital statistics. And is particularly we want to have a strong integration with the health sector. Birth and death notification, if we recall, the most of the data comes from the health, and we want that the health sector applications, such as electronic medical records or the medical cause of death certifications, if they're digitally available, can connect the CRVS application. And there are some key principles that what we have learned, from the implementation practice. We would like to have a user-centered design for registrars and health workers. Ideally, we want to have modular standard-based architecture based on the FHIR open APIs and the coding with the ICD-11. We would like to have online and offline capability for low connectivity settings. We want to have identity linked data, population register, and national IDs, secure private, privacy protective, auditable data flows, and ICT choices must reflect the country's maturity level, resources, legal frameworks, and infrastructure. And systems can be built incrementally, maintenance and capacity. Third key principle is smart implementation planning. So again, this is so important that needs to be replicated, or said again, that do not replicate or digitalize all paper workflows. This. And one of the best practice is process mapping as a planning and analysis tool. What we have learned that the participatory process analysis help unpack the real problems. But it should be combined with all the existing documentation in a country, because many times the countries might have the process mapping without looking all the existing information. So please, if we want to do this activity, which is recommended, use all the previous assessments what you have in a country. There's most of the time digital health strategies. There's already built enterprise architecture. Then we might have a legal review, all business process diagrams, digital health maturity analysis, and also review the current national reforms or upcoming reforms, digital health, CRV modernization, ID systems, e-government, interoperability initiatives, and collect with the field insight from the process mapping, frontline workflows, pain points, and delays and gaps. And together, these inputs create the complete picture of what needs to be fixed, what needs to be redesigned or digitalized before moving to requirement collection and solution selection. And how we should choose the different digital platforms. It would be important to look that you match the country's maturity. If the country is very nascent or level 1 with the civil registration, vital statistics, or the health modernization, you might want to use simple tools, standalone models first. If the country is already more established, you definitely want to move with the API-based integration. And the level 4 and 5 are the platforms that supports interoperability and shared services. What is important to look also that any application and the platforms that you want to procure fit national strategy and reforms. You don't want to have the systems are too fancy if you don't have the architecture and strategy that support its use. But avoid locking in PDF workflows because you want to have future-proof design. The implementation can be phased, but you have to build architecture design in advance because it's very difficult to do it afterwards and try to fit maybe already obsolete tools within the modern architecture design. So choose systems that can plug into future interoperability layers. And you have a different solution choices. There's few actually open source tools for the CRVS, and there are proprietary solutions, and they all have the pros and cons. In global level, the UN, including the PAHO and WHO, we recommend the open source solutions when they are available. They have open code, and you avoid the vendor lock-ins. They have no or very low licensing cost, flexible national workflows, They usually have a strong alignment with the standards and open APIs, but you still need to have funding for hosting, customization, and integration. Proprietary solutions have some benefits, but also they're coming with a higher cost, and also the implementation and future proof, of using these proprietary solutions might be a challenge because you have a closed code, you're dependent for the vendors, manage hosting and support, but they usually have very fast deployment because the vendors are doing the most work for you. But it really have high long-term cost and customizations are limited and API openness varies. So this needs to be investigated and enforced in the RFPs when you're doing the documentation for the vendor competition. Requirements collection also what we recommend, you need to have a must mandatory functional requirements, and then you can map desired and optional. And these mandatory ones need to be open APIs, allowing the interoperability within health, ID, and statistics. They need to be compliance with the CRVS legal and data standards. You want to have that you can configure them to national workflows. And both open source solutions and proprietary solution can meet must if enforced and enforced in the procurement. Desired requirements of flexibility and customization. Proprietary solutions, you want to have vendor managed maintenance at least for 5 years. You want to have multilingual possibilities, user interface which is user friendly and possible to do analytics. And optional and the nice to have would be dashboards, add-on models, and non-core features. For instance, you would like to maybe to have artificial intelligence data coding, or you would like to have the better the dashboard design, etc. But these are not required, to have functional system. And WHO ICD-11 tools for mortality certification and coding. There are plenty of these, and they are all open source. And if you would recall, ICD-11 coding is mandatory. So you would like to look, how to fit the ICD-11 coding, but potentially take advantage of the other WHO open source tools and how to fit these into your mortality surveillance and reporting architecture. So WHO have digital open rule integrated cause of death selection DORIS tool that can be used in the vital statistic part. Also, their ANACO 3 tool assess the causes of death data quality. And also WHO have the paper medical certificate of death from the 2016, which is a global certificate. This is recommended for the countries to capture and certify the deaths. And also WHO have done the electronic medical certificate cause of death specification. When you would like to digitalize a form, they are available, the technical specifications for the vendors. And how the implementation pathway should go. The first, when you have the new software solutions and you have done your requirements, you have selected the tool, you need to do first the proof of concept. You have to test one core workflow, for instance, EMCCD or notification process in very small scale, 1 or 2 sites, validate its usability and business process changes, and identify potential technical legal adjustments before you move on the larger pilot. And the pilot is needed to expand the multiple facilities and real users, test full workflow and to end-to-end, measure data quality, usability, and stability, refine training and support needs before scaling up. And the scaling up is a gradual national rollout with the governance and the budget, strengthen host and security and support, integrate with the ID statistic and national architecture if possible, and do the continuous monitoring improvement. And one additional good practice tip is that before selecting the actual the tool, request vendor demonstration presentation early to compare usability workflows and alignment with the national requirements. So I would suggest to do this and early on when at the planning state before to doing the final selection of the tool. And the key takeaways from this presentation is establish strong governance and national coordination first, very important. You want to have a cross-sector steering committee, including the CRVS health ID statistic and digital and ICT folks. You want to have an anchor agency responsible for the interoperability and standards. Usually this is civil register in many countries. You want to have a clear roles, decision making and accountability, and also discuss about the financing in early on. Start with the process mapping and existing documentation to understand where you stand, what is current situation and where you would like to, what you would like to achieve, what is infeasible in short term and long term. You want to have assessments, digital health strategies and legal reviews, and also to understand if there's an enterprise architecture or if there's a plans to do it, the readiness reports or any business process mapping data from the previous exercises. Define clear requirements, must, desired and optional. Prioritize open APIs, interoperability with the health, ID and statistic. Ensure alignment with the national reforms and architecture. This is very important because otherwise you would have silo project. You select a solution, whether it's open source as globally recommended or proprietary through RFPs, but either option work if standards are enforced. Focused on modularity, configurability, and no vendor lock-in. And the no vendor lock-in is obviously a bit of problematic if you have a proprietary solutions because you pay for the vendors support for X amount of years. And after that, it would be lock-in if you don't continue to pay. Implementing phases, do the proof of concept, then pilot, and then national rollout. Pre-design workflows, not digitized paper. Monitor readiness at each state, and plan realistic long-term sustainability. Need to clarify responsibilities among the different users. Also decide who is the main financier systems, or if each of the agency contribute, how is it done and what percentages. Identify ongoing needs early, host and support maintenance and training, and incorporate international plans as capacity grows. And the one of the key takeaway that the finance doesn't need to be perfect, but it needs to be discussed because it will be difficult to maintain the systems and expand the systems if you don't have financing already considered in advance. And in the last slide, I just wanted to put some key global guidelines and tools. There are a lot published and globally. Many of them are available in English, but also in Spanish. There are a lot of documents on CRVS and legal identity, CRVS system selection, digital public goods, and also a lot of information on digital health architecture and interoperability, digital IDs, government technologies and e-government, and lastly, um, big portal on ICD-11 mortality and MCCD tools available. I recommend to look or further advice for using the existing materials. And this is the all from my side today. And if there's any questions, please ask. We have Dr. Victor Hugo, and including myself and Analia, to respond any specific questions. Thank you.
Muchas gracias, Catherine. Excelente tu presentación. Nos has resumido
Thank you
todos
very
los
much,
elementos
Katri. Your
claves
presentation
que
has been excellent.
debemos de
You've
tener
very
en
much
cuenta
summarized all
dentro de
the
este
key elements that
proceso
we
de
need to
transformación
consider
digital de los
in all
registros
this digital
civiles en
transformation
América Latina.
of
En
civil
particular,
registration in
quiero
Latin America. And I most specifically want to
recapitular sobre las
recap
partes
on
que
the
has expresado en tu
elements
presentación.
you've
Hablaste de los
talked about in your
conceptos básicos
presentation.
de
You talked
los
about the
registros
basics
civiles y por
of
qué son
civil
importantes.
registration and why they're important.
Digamos, destaco
And
el
here I
significado
want
que
to
tienen
stress the
los
meaning
registros
that
civiles
civil
como una
registration
garantía para la
has as a
identidad
guarantee
universal de
for the
todas las
universal
personas.
identity of every
Porque más allá, como
individual,
en una diapositiva
because
que mostraste,
beyond, and looking
aparte
at a slide
de
that you've
conceder
shown,
el nombre, de
in
registrar el
addition to
nombre
giving
y
someone
darle
a
una
name that
identidad,
is
es un
registered and
pasaporte a
providing
los
that person
sistemas
an
de
identity
protección
is a
social y a la
passport to
garantía de todos los
protect social
derechos
protection
humanos.
systems
Por
and the
otra parte,
guarantee
hiciste
of her
una
human rights.
rápida
You
exposición
also
sobre la
exposed real
arquitectura
quick
digital, la
on the
integración y la
digital architecture,
interoperabilidad,
integration, and
que esa
interoperability,
condición sine qua non
and like
para
the
avanzar en el
conditions
proceso de
that
transformación de
are
los registros
suitable
civiles y
to
las estéticas
advance
vitales. Y
in
ahí
these
también quiero
processes.
relevar
And I
una
also
diferencia
want to
que
highlight a difference
planteaste y
that
es
you
sobre
mentioned, which
la
is
diferencia
about
entre la
the
integración
difference
y la
between
interoperabilidad. Una
integration and
cosa es
interoperability,
intercambiar
because
o compartir datos
exchanging or
entre los
sharing
actores del
data
sistema y
among the
otra
different
cosa
systems
es
actors is
realmente
different
actuar
to
bajo un
actually being
esquema de
able to
interoperabilidad.
perform under an
Entonces,
interoperability
es
scheme.
bien
So
importante,
it is very
digamos, que
important
cuando estemos
that when
avanzando en los procesos
we
de
are moving
rediseño del
on in
sistema
the
de registros civiles y
processes of
estadísticas
the
vitales, pues
redesigning of
lo
these
que
systems,
tanto
the
recalcaste
CRVS
al ver
systems,
un
just as
rediseño
you have
en
very much
donde por
um,
defecto todo el
made
sistema sea
emphasis on,
digital.
the whole system needs
Y
to be
esto, digamos,
digital by
para
default.
estructurar un
And so
sistema
this is
integrado
to,
desde
in
el
order to
principio
structure
hasta
an
el fin
integrated
en el
system
registro
from end to end
de los hechos vitales.
in
Finalmente, hiciste
vital
referencia
facts.
a tres
You also
principios
refer to
claves
three
para la
key
construcción de los
principles for the
sistemas de registro civil
construction
y estadísticas
of
vitales. El primer
CRVS
principio que tiene que ver
systems. And the first
con
thing that has to do
lo que
with
aporta
what's
las
the
tecnologías de
contribution
información
of information
como
technologies
facilitador de, digamos,
as
o
the
habilitador
or the big
de
enablers
la transformación digital.
of
Y
digital
aquí, y muy
transformation. And
importante,
here's very
que
important
estos deben de estar centrados
to
en los
remember
usuarios
that these
finales,
need to be
las
focusing
personas que
on the end
registran
users,
tanto los
those
hechos
that
vitales desde el
are
punto de vista
recording
médico como en el
vital
registro
facts
civil,
from the medical
pero
standpoint
también
and also
que
civil
tenga un
registration,
flujo de valor
but
para la
also that
ciudadanía.
they have a
A eso deben
value
estar
flow for the
centrados
citizens,
estos,
that they
la
understand that
construcción de los nuevos sistemas.
this needs to
Un
be
segundo principio que
hosted in the
tiene que ver
construction of
con
the new
toda la
systems. A
planificación
second principle
previa
that has
que
to do with
debe,
all the prior planning
pues,
that
digamos,
must
tenerse en cuenta para
be
la
considered
transformación
for the
basados en los
transformation,
niveles de
all of them
madurez
based on
digital que
the
tengan los
various
países. Y un
levels of
último
digital
principio
maturity the
es
countries have. And the
la
last
necesidad
principle to
de
highlight is the
constituir un
need to
ecosistema que sea muy
establish an
incluyente, tener
ecosystem that is
una
very much
gobernanza
inclusive.
sólida
So having a
que nos
robust
aparte
governance
o nos
that
aleje de toda la
takes
fragmentación
us
del
away from
sistema,
all
que
the
nos
systems
permita
fragmentations
a través de,
and that
es decir, el
allow us
mapeo,
through
poder
mapping
estructurar
exercises
un
to be able
sistema
to
que pueda ser
structure a system
compartido y
that
usable
can be
por todos
shared
los
and
actores
usable
del sistema,
by all the
incluyendo a la
systems
ciudadanía.
actors,
Y
including the
también
citizens. the very
relevaste
population.
la necesidad de que
You also
antes de
talked
iniciar
about
estos
the
procesos
need
de transformación,
of
de embarcarse, digamos,
having
con los
that
desarrollos
before we start with all
tecnológicos,
these systems
pues hay que
to
hacer pruebas de concepto para saber
run
si
concept
esa
testing
realidad la hemos
so that we are able
interpretado
to know
y
whether
hemos
that's a
proyectado
reality that we
también lo
have
que
been able
queremos que sean
to
los registros civiles
interpretate
en la
and
región.
apply into what we
Bueno,
want the
sí,
civil
hay
registration to
unas
be in the
preguntas
region.
que no
We
le he
do have
respondido,
some
pero
questions that
que
have not been
creo que
answered,
el tiempo nos da
and I
para
think
hacerlas. La
time is
primera
giving
pregunta
us
tiene que ver
some space for
con
that. First question has to do
la pregunta de Lucy Ruiz. Ella pregunta dónde se puede acceder a información sobre estadística de abortos y muertes perinatales por esta causa. No entiendo muy bien al final por esta causa, pero si se refiere a las fuentes sobre abortos y muertes fetales, pues los sitios oficiales de el CDC, de UNICEF, de Naciones Unidas, de la OMS, pues son fuentes confiables donde se pueden recabar estas estadísticas. También los sitios oficiales de las oficinas de estadística de los países son una fuente que tendría que siempre usarse. Hay una segunda pregunta que tiene que ver con una consulta de Argentina. Dice la persona que nos pregunta que hay dos problemas críticos por resolver en la gestión de los sistemas de registro civil y estadística capitales. Uno es la documentación o el registro de las personas fallecidas indocumentadas, ¿sí? Y cómo, digamos, dejar el registro de datos biométricos allí. Lo mismo pasa con los nacimientos, ¿sí? Cómo incluir, entiendo yo, datos biométricos para el registro de los recién nacidos. Catherine, si quieres comentar sobre este particular.
Mhm. Actually, nowadays, a lot of biometrics, is especially the portable machines. They have increased the quality a lot. In olden times, they were not very accurate for the smaller children, but nowadays they're pretty good. They even the use with the under fives, and the cost have gone down a lot. So they could be possible solutions to improve it. However, I also would consider that there's a legal limitations. Not all the countries have legislation where the biometrics is allowed, and especially how to store the data and the biometrics. So I would think that if you would like to use the biometric methods, um, it would be advisable to review, the existing markets. There are many solutions out there, and to compare the costs, but you need to do the legal review in order to allow to use these technologies. Um, um, I don't know, Analia or the Victor Hugo, do you have any other potential options on this? Because I do understand that, they're using the ink for the kids or the adults is kind of old-fashioned.
No, solamente agregar que efectivamente esto es uno de los
Now, just
aspectos
to add
críticos
that this is
dentro de
one of the
los
critical
sistemas de registro
aspects
civil
within the civil
y es
registration
algo que
record systems,
implica
and it is
pues la
something that it
revisión y la
implies
armonización
the
legal
review
de todas las
and legal
normas que rigen
harmonizing of
la
all the
identidad
standards
de las personas.
in the
Y pues
identity of
esto
people.
generalmente
And so
eh,
generally,
pues está eh,
this
dirigido por las oficinas de registro civil y de estadísticas vitales, de registro civil en particular. Entonces, habrá que revisar eso, lo mismo que con los servicios forenses que brindan servicios de identificación. Entonces, digamos que toda esa revisión normativa es obligante para llegar a, digamos, a armonizarla también con las normas que se dictan en los países sobre la protección de datos personales. Es un tema que, digamos, muy actual y que se tiene que adelantar. Las experiencias son diversas en
It's a
todos los
topic that
países.
is very trendy, and then all the evidences are different in the various countries.
Analia,
Analia?
Sí, no quiero. Argentina tiene su particularidad porque es un país federal y hay algunas estrategias que han
In
implementado
Argentina,
soluciones
it's a
como las
bit
que
different because
cuenta
it's a
Catri.
federal
Es
country, and there
cierto,
are certain
como dice
situations,
Irene,
just
que
as
para
Katri said
poder
and as
implementarlo a
Irene
nivel
said,
nacional
that to be
se
able to
requiere de
have
una
a national
política
implementation,
y una normativa,
a
como
policy and a
sugería Catri, de
normativity is
Estado
mandatory
para
from the
normatizar todo
government to
eso
be able to
en el país. Y bueno,
regulate
requiere
this on the whole
inversión para
country.
poder
And it demands
tecnología y
investment to
tener,
incorporate
digamos,
technologies
todo el proceso de identidad digital
and to
desde que se
bring all the
nace
process of
hasta que se
digital
muere.
identity
Eso
from
es lo
birth to
que,
death.
digamos, se
So
viene trabajando y
that's
por
something we
supuesto,
have been working
bueno, ustedes
with.
dijeron
And as you've
los
mentioned,
desafíos que esto tiene
this has its own
para los gobiernos.
challenges embedded for other
Creo
governments.
que hay otra pregunta.
I think there's another
Ahí hay
question,
una pregunta más de
one more
Barim.
question.
Aybar, ¿qué medidas se podrían implementar? Uy, se
Um,
me fue. Ahí creo que la respondió Catria.
I think Katri already answered it
¿Qué
all.
medidas se podrían implementar para
About what
reducir la
measures could
subnotificación de
be
muertes
listened to for the
en zonas rurales o
sub-notification of
difícil
deaths
acceso? Catri, ¿querés
in rural
ampliar o
areas
querés
or difficult
contestarnos por
access?
chat?
Could you answer or tell us about what you answered in the chat?
Well, this is the big issue in many countries, especially because in a lot of countries, the half maybe of the deaths do not occur in the health facilities, and some of them might occur in rural sites without the medical doctors. But if there would be the certifier, because usually medical doctor in especially in our region in Americas, only doctors are allowed to give the medical certification of the deaths. If they do it, in the communities and not in the health facilities, there are the mobile applications that work offline and online, and the doctors can fill the notification of the deaths and the frame A and a B, which is also cause of death information through the mobile application. Also, if they do happen to have, the health facilities or nearby, like if they have any digital EMRs or the tools, like that could be the one option. And also, the WHO has developed virtual autopsy tools, and nowadays there's also the mobile app to do the virtual autopsy in the cases, like when you don't have the medical doctor to certify. So there's a ENTA protocol, how to do this. It's with the interviews with the next of kin or the people close to the deceased to understand, what is the cause of death information. And you might have also the mobile teams from the civil registration with the tablets that can go for the communities. So there's technologies available to do this, but the most of times you would need to have some sort of, the tablet or mobile phone application in order to use digital means, to facilitate notification and certification of the deaths. But I don't know if the Victor Hugo and Analia has something, like from the country
Sí,
perspective, please.
sí, sobre la autopsia verbal, además de las herramientas, los
The
instrumentos que se han
verbal
diseñado para
autopsy and
hacer
all
esta,
the
esta
elements and tools
captura de
that have been
información
designed for this
en áreas
capturing of
dispersas y
information
de alta
in
ruralidad,
foreign areas or highly
también
rural areas.
establecer los
you also
procedimientos y
need to
los
establish
acuerdos
what procedures
interinstitucionales
need to be
para
conducted
validar la
in
información que se
interinstitutional
recoge
agreements to
en estas
validate the
herramientas de
information
autopsia verbal.
gathered by these
Porque de
verbal
otro,
autopsy
pues
tools,
si no se complementa
because
todo este
if
proceso,
all these
no
process is
pasaríamos
not
de
complemented,
tener
then we
solamente
wouldn't
el
be able to
conteo de hechos
move from
vitales que
just
pueden
having the
suceder
counting
en
of vital
en las
facts that can
comunidades.
happen
Pero
in
lo que interesa
communities.
también es que esta
But what
información
happens,
llegue
or
a
what's important here is
convertirse
for
en
this
un
information
registro
to
válido,
become
¿sí?
a
de
valid
los hechos vitales.
registration
Y
of
eso
vital
requiere
facts.
procedimientos
And that demands
concertados
procedures
entre las
that
entidades
need to be agreed upon
responsables
between
para
the
hacer esos
entities in
procesos de
charge to
validación.
conduct these
Incluso
validation processes,
en donde la estrategia ha
even when the
madurado,
strategy has
se
grown,
integran los equipos de salud
where health
centrales para hacer la validación
teams
de la autopsia verbal,
that are
aunque el médico
central can get together
no lo
and
haya
agree
conocido,
on that verbal
basado
autopsy, even
solamente
if
en el
the physician
reporte
had
que ha
no
sido
information on
recogido
that
por otros
on the
actores, que
area, by
usualmente
information
son
that was gathered
otros trabajadores de salud
by
hasta
other actors
agentes comunitarios de
with
salud
community
que
healthcare
se
community
entrenan en el
agents
uso de estas herramientas.
that
Entonces,
are trained in the use of
todo
these tools.
el proceso puede aportar
So the
muchísimo
whole
a la
process
mayor
can
completitud
bring a
y
lot into the
cobertura del
completion
sistema
and
de
the better
registros civil
completion
y
and
estadísticas
coverage
vitales
of
con la
these
implementación de
CRVS
estas
systems
herramientas nombradas.
with the implementation of these tools.
Bueno,
Excellent,
no
Victor.
sé si
There's
está
one more
el
question.
tópico que vimos hoy, pero
I don't know if it's about this
pregunta si
topic
se
in
le permite a
particular,
un
but
médico otorgar una
he's
licencia
asking if a
médica
doctor
basándose
is allowed
solo
to
en una
provide a
teleconsulta
medical
sin
license only
examen físico
based on a
presencial en la región de
teleconsultation
Las
without an
Américas.
in-person evaluation, physical evaluation in this sector of the Americas, in the region of the Americas.
I'm not sure if the question is actually based on medical leave or maybe it's a typo. But yes, the medical leave can be given through the teleconsultation alone if you're sick. But if the question is actually whether teleconsultations alone would be enough without the physical examination to certify the death or to declare, that someone is a death, I would say in the United States, in our region, including the U.S., it's not allowed. In universally would not allowed because a lot of legislations they say that the only the medical doctor can do the certification of medical certification of the death. That's by the law across the many countries. Also, it would need to have, actually to see the body. You would need to have a physical examination of the body. And this happens even that, like if there's a community death and the body is just found at the home, many countries dictate also the legal investigation of these deaths to understand if it's a natural or unnatural death. So, no. However, there are globally a lot of discussions around this, um, um, especially because of the COVID pandemic. This topic came under the discussion because there was a limited amount of medical doctors, whether the nurse assisted teleconsultations. Um, the nurse would do the physical examination with the teleconsultation of the medical doctor. And if that would be a solution. And there is a couple of pilots. I know the one pilot from Japan, and there have been discussions, for instance, in Finland, because we have a lot of rural areas and there's not enough doctors. Um, However, a lot of time the legislation would not allow this. And I don't know, from the medical doctor's perspective, maybe the Victor Hugo and Analia might have, the few notes, like how the doctors would feel to do that, through the teleconsultation in general. But I would just say universally is not allowed.
Sí, es un sine qua non para los médicos certificar las
That
causas
is
de
correct.
muerte,
It's not
hacer
possible for
primero
a physician to identify
cumplir
the
todos los
causes of
procesos
death.
recomendados por la
They
misma
have to
OMS de
follow all the
declaración de muerte
processes that
y
have been
destrucción
stated
de
by the
cadáver
the very
de examen
WHO,
físico,
the
de
physical
la
examination,
revisión de
the
todos los
review of
antecedentes
all the
que
medical
puedan
history
existir en
the
historias
patient may
clínicas y otros
have in any
documentos de
medical
salud de
records or any other
personas
health
fallecidas
documents of
para
the deceased to be
establecer una
able
causa
to
de muerte, pero
establish
sobre
an
todo
actual cause of death.
verificar que
But
se está
most
certificando
specifically
a
to
una persona
validate
efectivamente
that is
fallecida.
certifying a person
De
who's
modo que
actually dead.
tal vez la
So,
teleconsulta yo vería que
teleconsultation is something
podría
that I
ser,
would
digamos, como
find
una
that it
forma de
could be
acercamiento
as a way
para una
to
estrategia
have an
como la
initial
que ya se
approach
mencionó de
for
autopsia
strategies
verbal,
such
en
as the one
donde
mentioned
hay
for verbal
unos
autopsy when there are
recolectores, ¿sí? Que
uh,
son trabajadores de salud de
certain
la salud
information
expertos,
gatherers, which
asesores
are
del caso incluso,
healthcare
que
workers,
recogen
healthcare
historias, ¿sí?
providers that
Y el
gather
médico
medical
puede
records, and then
profundizar o
the
ayudar a
physician
profundizar
could
en el
uh,
interrogatorio
delve
y
into or
solamente
lead into a
basado en los
deepening in
algoritmos
the
que establece la
inquiring, and
misma
based on the
metodología de
algorithm
autopsia
established
verbal,
by the very verbal autopsy
poder
methodology,
llegar
then
a
would be
una
able to
causa
aim
probable,
toward
pero sin
uh,
que eso
probable
signifique la
cause without it
certificación médica,
being the
solamente
actual
para
medical
uso
certification, but only
estadístico, ¿sí?
for
Y que no quede,
statistical
digamos,
purposes,
solamente como
and
el conteo de un
not to
hecho vital.
be like
Pero
the
esto
uh,
requiere,
recount of a
digamos,
vital fact.
procedimientos
But this
bien claros
demands very clear
para poder
procedures
verificar. En Colombia
for its
hay una
application. And
experiencia
here
que
in
se
Colombia,
sigue avanzando a
there's an
partir de la pandemia,
experience
como
that
mencionó Catherine.
has continued to be,
Se hicieron
particularly
varios
after the
pilotos
pandemic,
y
as Katrin
una
mentioned, with
región
several pilots. And
incorporó,
there was
digamos,
a
esta
region that
tecnología de
incorporated this
autopsia verbal
technology
y ha
of
conformado
verbal
equipos de
autopsy
salud con los
and has
cuales se
put
aproxima un
healthcare
poco como
teams
a las
that look a little
probables
bit
causas de la
to
muerte de una
probable
persona
causes of
con base en
death
el interrogatorio
reviews based
y
on
lo
the
registrarán
inquiries
pues
and
apenas ahí
the
nada más.
surveys recorded, but that's as far as it gets.
Bueno, ya casi estamos en tiempo. Hay una pregunta
Okay, we're
muy
almost
concreta,
done with our
Víctor,
time, and we have a
de
very
Lucy,
specific question
nuevamente, que para
from
realizar la
Lucy
autopsia
again,
virtual del médico
saying
debe ser
that if for the
certificado en el uso de la
virtual autopsy,
plataforma de
the
la
physician
OMS
needs to be certified in the
y
use of the
OPS y si en
WHO and
Colombia es
PAHO
legal.
platforms, and whether it is legal in Colombia or not.
Bueno, o sea, la estrategia de autopsia verbal en Colombia
Verbal
sí se
autopsy
adoptó
strategy
durante la
was
pandemia
adopted in
como
Colombia
una
during the
herramienta
pandemic
para recaudar,
as a
digamos,
tool
información sobre la mortalidad
for
en áreas
information
dispersas
gathering
y
about
estuvo
mortality
sustentada
in
por una
dispersed
norma
areas, and it was
transitoria
supported
del estado de
by a
emergencia de la
temporary
pandemia.
standard
Después de
because
esto,
of the state
digamos
of
que
emergency
no
the
existe
pandemic brought
hoy
about.
ese respaldo
But
legal
aside
para
of that, there is no legal
incluir la
support to
autopsia verbal, a
include
menos
verbal
que,
autopsy right
digamos,
now,
la
unless
entidad de salud esté
the healthcare
verdaderamente
entity
comprometida
is
con,
actually committed to
digamos, con el proceso
the
y
process,
lo hace solamente a
and it
nivel
is
de
only being done
causas probables, pero
at the level of probable cause.
no eh, ha implementado, digamos, como un estándar
But it's
nacional.
not, there's no
Todavía
national
está en
standard
una fase
implemented on
piloto
that. It's
en el área
still
donde
and like a
se ha
pilot
incorporado.
phase in the area where it was accepted.
Bueno, gracias, Víctor. Gracias a todos los
Thank
que
you, Victor, and
participaron
thank you all
y los
of
que
you
participaron
who attended,
de este
and those of
tercer
you
webinar
who
que
were
cierra
a
el
part of
ciclo
this
de este
third
año, al
webinar that
menos de lo que es registro
ends
civil y
the cycle
estadísticas
of this
vitales.
year, and at
Creo
least
que
and
la
civil
pregunta que tengo
registration
ahí
in
sobre el
vital
potencial de la
statistics. I think
inteligencia
Marian's
artificial lo
question on the
vamos a
potential
dejar
of artificial
como tema
intelligence
de
is something we're
apertura del
going to leave
próximo
as
año,
an
porque seguro
opening
que va a facilitar mucho
topic
las
for next
preguntas que
year's webinar,
ustedes
because I'm pretty sure it's going to pave the
estuvieron
road for many of the
o que
questions
estuvimos indagando en este espacio. Y
that many of
recuerden
you
que
have
si
in mind
buscan
during
el
this
itinerario
space. Do
informativo
remember
o el
that if
Learning
you
Pathway
find
dentro
the learning
del
pathway
campus virtual
within the
de
virtual
OPS
campus of PAHO,
y van al itinerario formativo de
and
salud digital,
find the
pronto todas estas
training
cápsulas de
schedule, then
conocimiento
you
van a
may have
estar
all
como
these knowledge
webinarios
capsules as
certificables. Ahí van a
certifiable
poder
webinars, and then you'll be
hacer la
able to
evaluación y obtener el certificado por haber
present the
participado en este
evaluation
ciclo
and obtain
de
the
aprendizaje
certificate
del
for
programa de
having
salud digital.
been
Así que bueno, creo que
attendees
con
in
eso nos
this
despedimos
cycle of
y ya
webinars.
hemos
So with that,
pasado
we say
del tiempo.
goodbye, and we've been
Bueno,
a little
muchísimas
bit above our time, but we
gracias,
thank you so much for
Catherine.
staying this
Gracias,
long.
Víctor, por
Thank you,
tus
Katrin, for
aportes.
excellent presentation, and thank you, Victor, for your input.